Hello, it's Phil from Healthcare Business News, and today I'm joined by Dr. Ankit Shah. And I first learned about Dr. Shah in the March issue of Healthcare Business News, where he contributed a very interesting article, and when I read it, I wanted to reach out to him. Dr. Shah, thank you for joining us.
Well, thanks for having me.
And Dr. Shah is in charge of the interventional radiology program at Valleywise Medical Center in Phoenix. We know that Phoenix is a hotspot right now
Yep.
Arizona is a hotspot. So, Dr. Shah, in your own words, how would you describe what interventional radiology is?
Well, and simply put, we're the newest specialty in medicine. We just recently got our approval to be a separate specialty. We used to be, and we still function in a lot of ways as a part of radiology departments in a lot of programs, but basically we do minimally invasive procedures on patients that would otherwise be too difficult to have a surgical intervention or undergo general anesthesia a lot of times all over the body. We cover head and neck issues, including stroke in certain hospitals, to clots in the lungs and in the legs, and in addition to bleeding all over the body, as well as cancer care and a lot of stuff in between, including pain management. And we are basically a specialty that thrives on using imaging in different modalities with providing safe options for patients rather than very morbid surgical techniques that can result in more complications.
So I know that this has to call for a lot of collaboration with the other departments.
Yep.
How do you handle that, and how has it helped your patients?
Well, a couple of things. I mean, as interventional radiologists, we've invented a lot of specialties. I mean, not invented a lot of specialties, but I would say invented a lot of procedures that a lot of other specialties partake in. But we've stuck around and we've been very adaptable. But one of the chief things of not really having a body part that we concentrate on is that the relationships that we have within the hospital system is key in ensuring that we can have a impact on patient care. One of the biggest things is that the benefit of my healthcare system is that there's not necessarily a impetus for competition amongst different specialties to do the same type of work. So it facilitates more collaboration because everyone is essentially salaried in the same way. And so by developing relationships with vascular surgery, even cardiology, as well as our oncologists and across the gamut, we're able to ensure that the patients can come to us in an appropriate fashion. We can provide them the appropriate diagnostic procedure or therapeutic procedure, and then facilitate better patient care. We've seen this, one of the chief outcomes that we've really improved here has been venous care and cancer care as well, as far as liver cancer goes.
What role has interventional radiology played in COVID care?
Well, one of the things that we realized early on, and some key interventional radiologists across the world were publishing on this, is that COVID creates a thrombophilic state. There's a lot of situations where people develop DVTs and PEs, as well as just the sequelae of severe coronavirus diseases, end-stage renal disease, or acute kidney injury. And these patients end up requiring dialysis catheters, which interventional radiology in a lot of places across the world are key in placing. And also we do a lot of pulmonary embolism and DVT work as well, because of these patients being hypercoagulable and developing significant clots. The ability to remove these clots and restore normal function in the right heart for the case of pulmonary embolism, or preventing post-thrombotic syndrome in the legs, has been very important for us. Lastly, not to be overlooked, a lot of these patients require long-term nutritional support after the complications of COVID have taken their case. And so interventional radiology is key in getting patients feeding tubes as well, percutaneous feeding tubes. And so those are some of the key things. And then that's specifically coronavirus patients. In addition to that, we've really been involved with keeping patients out of the ER by doing routine sort of drainage type procedures and cancer care in a minimally invasive fashion so that they don't require hospital stays or admissions. And so that has all been kind of keeping IR alive and thriving and dealing with the consequences of coronavirus, both as a disease itself and then the victims who are not sick with coronavirus but have other conditions that need to be treated.
And do you think interventional radiology will change as a result of the coronavirus?
I would think so, because of the fact that as moratoriums on elective procedures were placed all over the nation, interventional radiology still kept going forward. And routinely, the culture, or the norm is that interventional radiology departments are kind of staffed at the minimum, or sort of overlooked a lot of times in the overall hospital picture because of just the nature of our specialty and sort of prior cultural issues. So, but in this whole process, it's become clear that interventional radiologists have been a big part of the multidisciplinary care in patients from New York all the way over here to Phoenix, and providing quick, safe, and inexpensive care to patients. And so I think that our role in the hospital and our input is going to increase significantly as we come up with more and more creative solutions to deal with new problems as they arise, as we have with this pandemic.
And how, personally, how has the coronavirus impacted you? Are you working extra hours, under stress? How are you doing?
Well, I appreciate the question. I think all of us are feeling the stress of just having a disease that there's not really a good cure for, and protecting ourselves the best way possible. I think one of the benefits of the interventional radiology community is that we're very close-knit, and a lot of advice was given early on by the Society of Interventional Radiology on protection measures for the department. And we have had a lot of cases come through, and being our catchment and our safety net hospital in Phoenix, a lot of the patients who have no other options are here. And luckily we have the right infrastructure and culture in place to make sure that we're being protected. That being said, it's been challenging to socially distance myself from my partner in the reading room because indoor spread is very common. And so we've had to adapt the workflow in terms of where we put patients so that they are distanced from each other in the holding bays, and that appropriate cleaning times. All these protocols have really been challenging, but they've also, allowed for some growth and adaptation to keep us moving forward.
Well, Dr. Shah, once again, I really enjoyed your piece in our magazine. You're a very interesting and thoughtful guy with a great perspective.
Appreciate that.
Thanks for joining us, and I hope that in the 2021 RSNA you stop by and shake hands with me.
Okay, all right, I'm looking forward to it.
Thank you very, very much for joining us.